This is Radio Health Journal. I'm Reed Pence. This week, companies that offer egg freezing as a corporate benefit.
The whole problem of egg freezing is that it's really individualized, it's an expensive and a high-tech medical solution to what's really a social problem that we should address with social policies.
Egg freezing for social reasons, when Radio Health Journal returns.
When it comes to health insurance, understanding what you'll pay for covered services, prescriptions, and supplies is important, especially if you have a chronic condition like diabetes. Now, there's a new tool to help people with diabetes save money on test strips. Know My Copay is a website and nationwide telephone service that tells you the lowest copays for the top 5 brands of diabetes test strips in the market based on your individual health plan. Here's consumer advocate and nationally syndicated columnist Jim Miller.
Figuring out health coverage can be confusing. Know My Copay is a valuable free service that can help people maximize their healthcare dollar. By comparing the out-of-pocket cost of the various diabetes test strips available, people can make educated decisions about the products they use.
Know My Copay is sponsored by LifeScan, maker of One Touch brand blood glucose monitoring systems. Find the lowest copay for your test strips at knowmycopay.com or by calling toll-free 1-844-807-8936. That's knowmycopay.com.
Thousands of women of childbearing age receive a cancer diagnosis every year. Many of them who don't have children but would like them someday may face treatments such as chemotherapy or radiation that put their fertility at risk. For them, technology offers some insurance. Embryo freezing has been an option for them for some time. But what about women who aren't in a relationship yet and aren't in a hurry to get into one? The last few years, they have more options too. Today, egg freezing is no longer considered experimental.
Egg freezing, I think, is increasingly common. The number of births from egg freezing, obviously not all are necessarily reported around the world, but certainly it would number in the thousands of babies that have resulted from frozen eggs. Far fewer than the number of babies from IVF total, partly because the technology for freezing eggs effectively has really only came to its maximum potential within the last handful of years. But as it has become ready for prime time, because we now have technology where egg freezing probably makes it virtually as effective as using fresh eggs, more and more people are pursuing it for a variety of reasons, but primarily for fertility preservation.
Dr. Owen Davis is president of the American Society for Reproductive Medicine and a professor of reproductive medicine at the Weill Medical College of Cornell University. He says it's taken some high tech to make egg freezing practical.
The concern is that the formation of ice crystals in an egg can wreak havoc and could theoretically damage the structures that divide the chromosomes and therefore lead to genetic damage to the egg. The breakthrough really was this technique called vitrification, which is ultra-rapid freezing of the egg, where the cell water is rapidly replaced with cryoprotectant chemicals. So rather than slowly replacing the cell water, you fairly rapidly do this. And then because these chemicals that protect the egg are actually potentially very toxic if they linger, you have to freeze the egg very rapidly. So essentially the egg is plunged into liquid nitrogen. So it goes from room temperature to liquid nitrogen temperature instantaneously. And so the cooling rate is something like 30,000 degrees centigrade per minute, to give you a sense.
Under those conditions, Davis says frozen eggs may have survival rates of more than 90% when thawed. So women can now essentially reach back in time to retrieve their fertility, perhaps years later. But Davis says we might want to consider limitations to this technology.
The technology has gotten pretty good. I guess the biggest limitation now really is what is the appropriate use of the technology. And I think that most of us can agree that if you have somebody who's confronted with a diagnosis of cancer, for example, where she's either going to have surgical removal of her ovaries or have chemotherapy or radiation therapy that's going to basically result in a loss of all of her eggs, the ability to preserve one's potential to have a baby in the future by freezing their eggs certainly makes a lot of sense, and any risk that might be assumed by going through any kind of medical treatment is probably justified. I think the area that's a little bit trickier is what we call social egg freezing, which is a woman freezing her eggs at a younger age because she may want to have children at an older age where her fertility rate will be lower.
Mother Nature does not want us to have kids when we're older, and that is why women were given a biological clock.
That's Rachel Lehmann-Haupt, an expert on the influence of technology on family life, and author of In Her Own Sweet Time, Egg Freezing and the New Frontiers of Family.
Our fertility does start to decline in our mid to late 30s. It's definitely an individual thing for each woman, and your fertility doesn't drop off a cliff. It's a slow decline, and by the time you hit your 40s, it does become harder to have children naturally. Now we have a lot of reproductive technologies that are allowing us to push the boundaries on that and actually have children into our 40s. They include, in vitro fertilization, and also many, many more women are now getting their eggs frozen when they are in their younger 30s or mid-30s, and then unfreezing them and using them in their 40s. Now, that number of babies born to frozen eggs is small, and freezing your eggs still doesn't guarantee a baby, but there are a whole new tool chest of modern choices that families have in terms of family planning that allow us to outsmart our biological clock and have children older.
Today, some experts say at least 2/3 of all egg freezing procedures are for those reasons, to give women better odds that they can have a child at an older age. But some experts say that's exactly what the American Society for Reproductive Medicine didn't want when it cleared egg freezing for wider use. Dr. Marcy Darnofsky is executive director of the Center for Genetics and Society.
When they announced that they were removing the experimental label from egg freezing, they were doing that for cancer patients, for women who might become infertile as a result of treatment of a cancer. And the statement specifically said that it should not be interpreted as promoting social egg freezing. But despite that, the marketing juggernaut kind of rolled right over all the caution.
Egg freezing at a relatively early age can considerably lengthen the runway of fertility. But even if a woman freezes her eggs at 30, it's no guarantee that she'll get pregnant using them at 41. A study in the Journal of the American Medical Association shows a live birth rate of 47% with frozen eggs. But Darnofsky says the viability rate of frozen eggs is only between 2 and 12%, and retrieving those eggs is not without risk.
I'm so aware, because of the work that I do, about all the problems of egg freezing, both for the women that take these very powerful hormones that we know lead to very troubling short-term side effects, and that we have suggestions might lead to very dangerous long-term side effects that we just don't know about because no one's bothered to do the studies to find out. Because right now, it's a shot in the dark. We know about some of the problems. We don't quite know what the extent is, and we are starting to get the strong sense that the numbers of even short-term bad reactions are underestimated and underreported. The moderate and more serious reactions that count as ovarian hyperstimulation syndrome have been reported as occurring in anywhere between less than 1% and well over 10% of women. And that's a huge variation.
Despite the questions, egg freezing is even becoming a corporate benefit for women, most notably at high-tech firms like Apple, Intel, or Facebook.
What's happening is the technology is meeting them where they are and saying, okay, you want to wait. Now we're going to provide you with different ways to perhaps maintain your fertility.
Callie Williams-Yost is CEO and founder of the Flex Strategy Group, Work-Life Fit Incorporated.
Where this first started was in Silicon Valley, where you had very tech-savvy young women who understood the technology existed and were coming to their employers and saying, we want this. I have found that more and more organizations are aware that there's a life cycle in terms of their valued talent and what they're able to contribute when and how. And I think for each of us, we have to figure out what that work-life fit is for us.
Sounds like a pretty good perk. Egg freezing can cost around $20,000, and most women have to pay it out of pocket to have the chance to build a career and have a family later. But Darnofsky doesn't like it.
I think it's really unfortunate that companies are choosing to go down that road. They're really encouraging women to take health risks that are unnecessary for most women. And they're also discouraging companies in lots of sectors from putting in place more family-friendly workplace policies that would also mean that women wouldn't have to make these difficult choices. And then I think another thing that we could say is that the whole problem of egg freezing is that it's really an individualized, it's an expensive, and a high-tech medical solution to what's really a social problem that we should address with social policies.
Instead of offering egg freezing, Darnovsky says industry should offer more paid parental leave, more flexible work-hour policies, better daycare, and a chance to scale back the intensive expectation of hours on the job. In fact, she suggests that offering egg freezing as a corporate benefit might be disempowering, anti-feminist, and coercive. The message from the company is, we want you to put off having kids. We want you to work, and work a lot.
I think from the company's point of view, egg freezing means that they don't have to deal with demands on their employees that families do place. And they want more from the people that they employ. And, the people they want to employ mostly want to do a good job. But there have to be limits on the workplace demands when they get in the way of people having a reasonable family life and reasonable personal life. When employees get the message that the company expects that they delay having a family, they're going to be very sensitive to that message. So I can imagine an employee going to her supervisor and saying that they are going to have a child and need some parental leave, and the supervisor saying, oh, you probably want to know about this egg freezing benefit that we have. And I think that could very well be experienced as pressure.
But Williams-Yost and Lehmann-Haupt don't see sinister intent.
The Silicon Valley companies I spoke with said they're coming to us. They're telling us this is what they want. We have not come up with this on our own as some master plan to get the young women who work for us to delay their childbearing. It really was something that they were using to attract and retain talent because the talent wanted it.
I think that to criticize a company for offering good health insurance is probably not the best interpretation of a company. It's interesting because many of the companies that are offering egg freezing on their health insurance plans also happen to have some of the most progressive family policies, including paid family leave, paternity leave. And so I don't think it's coercing women.
However, Williams-Yost says if a woman gets the message as coercive, she needs to think very hard about whether putting off children is really what she wants.
If you avail yourself of this benefit and you freeze your eggs, make sure you're continuing to keep the eye on the prize as to what you want for your life. Because the one thing that does concern me is that you sort of freeze and forget it, and then all of a sudden years have gone by and you haven't tried to connect with a partner if that's what you wanted, or you haven't built a community of support around you in terms of friends, because you're going to need that if you decide to have a child with a partner or on your own. And make sure that if you take advantage of this benefit and you do freeze your eggs, you are still trying to be aware of the life you want and build that so that ultimately when you do decide to unfreeze the embryos and try to have a child, you have the life that you had thought you would want, and you haven't just put that on hold.
It should certainly be no surprise that people take advantage of egg and embryo freezing to extend fertility, because in an ideal world, family planning means getting pregnant when you want to, as well as avoiding it when you don't. You can find out more about all of our guests on our website, radiohealthjournal.net. You'll also find archives of our programs there, as well as on iTunes and Stitcher. I'm Reed Pence.
Radio Health Journal returns with medical notes in just a moment.
Do you know someone diagnosed with acute myeloid leukemia, or AML? AML is a type of cancer that begins in the bone marrow, but in most cases quickly moves into the blood. It can be difficult to treat, particularly for those who have changes in certain genes, as their cancer may come back quickly after being treated. There is currently no standard treatment for relapsed AML. However, there are ongoing clinical research studies. If you know someone who has AML, particularly if they have a mutation called FLT3-ITD, and have relapsed or failed to respond to chemotherapy, they can learn more about a clinical research study called QuANTUM-R. Call and speak to a study coordinator at 1-844-432-3892 or visit quantumrstudy.com to learn more and see if you qualify for this research study. Again, the number is 1-844-432-3892.
Medical notes this week. Suicide is one of America's top 10 killers, and a new report shows the suicide rate is rising sharply. A report from the Federal Centers for Disease Control and Prevention shows that suicides are up by nearly 25% since 1999, and the rate of increase has been gaining speed since 2006. Women are more likely to attempt suicide than men, most often by poisoning, but men are more likely to complete it because they use more deadly methods such as firearms. Hangings are also on the increase as a suicide method. Older people who are physically active have a better quality of life, and they can make strength training part of their exercise plan. A study in the journal Preventive Medicine shows that people over 65 who do strength training at least twice a week have a 46% lower risk of death for any reason than those who didn't do strength training. And finally, studies done on mice are the bedrock of medical science, but a couple of new publications cast doubt on how applicable those studies might be to humans. The first, in the journal Trends in Cancer, notes that mice are kept in labs that are much chillier than animals would prefer. Mice like temperatures about 85 and 90, and lower temperatures in the lab change how their bodies function. The second study in the journal Cell Host and Microbe notes that lab mice are usually kept infection-free, which isn't like the real world either. Researchers say mice with abnormal antibodies might skew the results of studies. And that's Medical Notes this week. More in a moment.
For many people with diabetes, maintaining proper blood sugar levels can be challenging and time-consuming. But now getting a snapshot of your diabetes just became a lot easier with the AccuCheck Connect Diabetes Management System. With test results automatically sent to an app on your smartphone and an online portal, the AccuCheck Connect system lets you log, view, and share data anytime, anywhere without ever writing it in a logbook. You can view results, easy-to-understand trend graphs, and securely store your diabetes management data in the cloud to access it from your mobile device or desktop. With the Connect system, you now have the tools to see the big picture wirelessly. Plus, you can text results if desired, attach meal photos, and view trends on the system's dashboard. You can even use the app's insulin calculator to enjoy a meal without the math. The AccuCheck system is available at Walgreens. Find out more at accu-check.com/connect.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.